When you get ready to enroll in Medicare, there are a ton of questions. When do I enroll? How do I enroll? Where do I enroll? So today, I'm going to answer all of your enrolling in Medicare questions, so stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare. And today, I'm going to talk to you about enrolling into Medicare. We're going to talk about the who's, the what's, the where's, the when's, maybe not the why's, but definitely the how's. Now, before we get started, if you find the information in this video helpful, I really appreciate it if you give it a thumbs up and subscribe, leave a comment down below. It lets YouTube know that this is important information for more people to find it. All right, so when we talk about enrolling into Medicare, we've really got two big parts initially. You've got your Part A and your Part B. That's kind of the first step into Medicare, is getting enrolled into both of those. Your Part A, that's going to be your hospital insurance. So think of it as anything that takes place in the hospital is going to fall under Part A. Part A does not have a premium. So a lot of people just enroll in it right when they turn 65, even if they're not going to fully get into Medicare because there's no premium associated with Part A. Part B is a little different of a story. There is a premium with Part B, and for the year 2020, the Part B premium has increased to $144.60. So Part B, you pay a premium. That's when you really want to wait until you're fully into Medicare to start your Part B. And our Part B insurance covers all of our outpatient things, doctor's visits, labs, things like that. Things that happen outside the hospital fall under Part B. So now that we know what Part A and Part B are, we need to know when do we enroll in Medicare and how to enroll in Medicare. And there's a couple different groups you might fall into. So our first group of people are going to be our people who are turning 65. So when you get close to your 65th birthday, you're going to start thinking about your Medicare enrollment, and you're going to be in what's called the initial enrollment period. And what that is, it's a big 7-month window where you can get into your Medicare Part A and Part B around your 65th birthday. So it's going to start 3 months before the month of your 65th birthday, includes the month of your 65th birthday, and also has 3 months after your 65th birthday month. So you've got this big 7-month window for your initial enrollment. That being said, you want to get everything started as soon as possible, because if you're coming in at 65, Medicare Part B is going to start on the first of the month of your 65th birthday month. So for example, if you turn 65 May 14th, your Part B is going to start May 1st. So you want to make sure you get the application as soon as possible so there's no kind of lapse. Because if you apply during the month of your birthday, or in those 3 months after, although you're still in your initial enrollment period, that Part B is not going to be retroactive. It's going to be a future month. So you want to make sure you have this all lined up to start exactly when you need it to start. So now, when you're turning 65, we've got two categories within there. We've got our people who are currently drawing Social Security benefits and people who are not drawing Social Security benefits. So if you're currently drawing Social Security benefits, your enrollment in Part A and Part B is automatic. You're going to receive a card in the mail about 4 months before your 65th birthday saying, hey, put you in Part A and we're putting you in Part B. You can stop that enrollment, but if not, you will be automatically put into Part A and Part B. Now, if you're not drawing Social Security benefits, your enrollment is not automatic, and that means you have to take the step to initiate your enrollment, because Social Security is assuming you're still working, and so they're not going to do it for you if you're still under a group plan. So if they assume you're still working, that means you're going to have to let them know, hey, I want to start my Medicare enrollment. And when you're in this initial enrollment period, it's pretty easy. You can actually do your entire enrollment online. I've got this link here for you, startpartb.com. And if you go to that link, it's going to take you directly to the Social Security website, the exact part where you would do that application. It's pretty easy to do. You just need basic info you already know about yourself, and you can submit it all online. This link is a quick, easy way to get you to exactly where you need to be. Now, if you aren't very tech savvy, you don't like the computer, you can also call Social Security, and I've listed the number here for you. It's 800-772-1213. That being said, no, Social Security, it's not just Medicare. You're going to have a ton of people who call, so you may have a long hold time. It might be a little more difficult to fill stuff out, so it's always an option, but really, electronically is going to be the fastest way, and you can track the progress online, which is a pretty great resource. Okay, we've talked about our turning 65 people. What if you are already 65, or maybe you're a little bit older, but you never came off your group plan? You were still working, you never retired, and now you're 68, 69, ready to retire and get into Medicare. You fall under what's called a special enrollment period. So when you're leaving your group coverage, you've got 8 months to get into Medicare Part B without having a late enrollment penalty. And really, you're going to want to make sure that your Medicare enrollment lines up with when your group coverage ends, because we want to avoid any lapse in coverage. We don't want any time period where we've got no group coverage, no Medicare. That leaves it really risky. So you're going to want to make sure you line those up back to back. Although you have 8 months, I would do it one right after the other. And to get that done, you're going to need a couple extra things. The most important thing is the employer coverage form. So what this form is, it's a form that's filled out by your employer that lets Social Security know that you've had coverage. You weren't just, walking around no health care coverage. You had group plan. You were paying a premium. And with this form, that's what wipes out that late enrollment penalty. Because if you didn't have coverage, the penalty comes into play, but the form shows that you've had coverage. And you can find this form on my website, and in a second, I'm going to show you exactly where it's found. The other thing about a special enrollment period, you'll probably have to do the application in person. I know that's not what you want to hear, but like I said, it's got a couple different factors with that form, a couple other things. It's going to be easiest to do it in person. You can sometimes do it through the mail too, but that also can slow down the process a little bit. If you're missing something, it's hard to communicate. In person's probably going to be your best bet. And you're going to want to get this started as soon as possible, because it can be slow moving, because you've got to get that form filled out by your employer, your application, everything to process. You want to make sure you can do this as early as possible to, again, avoid any lapse in coverage. Again, I'm going to list the number for Social Security. It's 800-772-1213. Call them. They've got it all there for you. So here's my website. I'm going to show you where that employer coverage form is. If you go up to the top and you click the Resource Center, you're going to have a couple other links there, my videos, important links, but we're looking at guides and forms. Guides and forms is when I have a ton of free resources for you that's going to help with everything Medicare. But more importantly, in that second row, you're going to see that employer coverage form, and you can download that straight from my website and print it out. And like I said, have your employer fill it out, and that's exactly what you need for this special enrollment period. The last group I'm going to talk about are people who did not enroll in their Part B at 65, but didn't have what Medicare considers to be credible coverage. So those are people who didn't have any insurance past 65, or people who had something like COBRA coverage, retiree coverage. Although those are health insurances, they're not considered by Medicare to be credible coverage. So if you fall into that category and you try to get into your Part B past your initial enrollment period, you have to follow this period that Medicare sets, and it's going to be from January 1st to March 31st. You have to apply for your Part B during this time period, and the only start date for this is July 1st. So, like I said, if you don't have credible coverage, this is you're stuck to this time frame. There is no other way around it. And again, COBRA coverage, retiree coverage is not credible coverage. So that means you're also going to look at that Part B late enrollment penalty. So that penalty is going to be 10% for every 12-month period you've delayed your Part B. So it's something to really think about. If you don't have credible coverage, once you hit 65 and you decide to delay it, these are all factors you're going to really have to consider. And again, probably will have to do the application in person, because there's more aspects into it than just a general initial enrollment application. So I hope this video helped you kind of figure out how and when to enroll into Medicare. If you have any questions, you can always call me. My number is 833-65-JAMIE. My website is medicarebyjamie.com, or you can email me at jamie@medicarebyjamie.com. Once you've got this piece done, then we can talk about the other aspects like supplement plans, which is what I do for a living. I assist people in enrolling into supplement plans to help them cover that Part A and Part B coverage that's not covered by Medicare. Again, I hope you like this video. Please give it a thumbs up and subscribe. Leave a comment down below. I left a movie quote in there for you. If you can tell me what movie it is, put it in the comments. And stay tuned. I'm going to end this video with a clip that's going to explain to you exactly how to use my website and how to find all of those free important resources. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.